you're providing intelligence around that data and you're presenting that data at the, at the right time, at the point of care and whatnot. Are you doing anything with regard to artificial intelligence, machine learning, to either look at the data during the clinical workflow or post-clinical workflow to enhance operation performance outcomes?
Yeah, so in the clinical workflow, right, one of the challenges with remote patient monitoring is the feeling by clinicians of don't just give me more data, right? Don't dump a bunch of patient-generated health data into my workflow. Help me know what to do with that. Who do I focus on? Which patients are highest risk of having an adverse outcome or having an ER visit? So we have a lot built into our rules engine that drives our clinical decision support pathways that really helps clinicians optimize for that efficiency of, who are the highest acuity, highest risk patients who need attention and intervention. And then, as you said, outside of that workflow, we are certainly building, analytics and algorithms to help them understand globally what the implications are. These protocols and guidelines can be incredibly complex and they can be conflicted if, many of these patients have multiple chronic diseases. So you have diabetes guidelines, you have heart guidelines, you might have kidney guidelines. That's difficult for human beings to sort of optimize for that intersection. So we're really interested in that space of sort of optimizing that individual patient decision-making in the face of complicated and sometimes conflicting evidence.
So is that, you have what the clinician really wants from digital tools and digital transformation and what patient really wants from the tools and transformation. Is it clarity of what I should be doing at this specific time, given just the complexity of all the information and the complexity of my chronic condition? Is that what they're looking for, or how would you describe what the clinician and what the patient are looking for?
Yeah, I think the best way a clinician put it to me was make it really easy for me to do the right thing and make it difficult for me to do the wrong thing for this patient. And, I think we as patients, we're all patients at some time, right? That's what we want. We want to go to that trusted advisor of our, physician or other caregiver and have them make the best decision for us based on our unique circumstances and our characteristics as an individual. So I think those two are aligned.
Yeah, that's fantastic. Easy to do the right thing, hard to do the wrong thing. That's fantastic, especially with all the deluge of information that's coming at them.